I'm Mr. Rohit Jain. I'm a trauma and orthopedic hip and knee surgeon. I've got a full-time NHS practice, and in parallel with that, I've got my private practice. So the knee injection therapy is predominantly used as an adjunct in managing hip and knee joint pain. The joint injections can be divided broadly into two categories. The first category is the pain-relieving joint injections, which are predominantly local anesthetic and steroid injections and hyaluronic acid injections. These injections, they tend to reduce the inflammation and help to improve the pain. They are very much effective in inflammatory pathologies of the joints. Hyaluronic acid is a lubricant which is naturally present within the joint. It also helps to improve the pain. Broadly speaking, these pain-relieving injections usually last for anywhere between 6 weeks to 3 months. There's a second category of joint injections which are called the orthobiologic injections. And these injections we use to harness the healing power of the body and improve the health of the existing articular cartilage. 80% of the patients respond to this treatment. 70% of the patients who have undergone this treatment have reported a significant improvement in the pain relief, which has lasted for approximately 3 years. By and large, joint injections are a very safe and effective procedure. There is a small risk of infection, but that is no more than a patient going in and having a blood test. The steroid injections can also affect sugar control in the patients who have got diabetes. If the steroid injection is put very close to the skin, sometimes it can cause a depigmentation of the skin as well. But by and large, these injections are very safe procedures. It really depends upon how bad is the osteoarthritis or any inflammatory arthritis in the patient, and how badly it has affected the structure of the joint. In patients who have got mild and early disease, these injections, they make a tremendous difference in improving their pain and thereby improving their function. Joint injections are predominantly given in an outpatient setting. In some cases, we do this procedure as a day case procedure, especially if the patients are coming in for a hip joint injection. By and large, you don't need any kind of full anesthetic, etc. Some patients may require a sedation. Yes, there are several alternatives for the joint injection. It really depends upon the patient's symptoms. Again, what the X-ray findings or the MRI scan findings are. There are various adjuncts to injections, which is, first of all, maintenance of a healthy body weight, avoiding any kind of prolonged impact, repetitive activities, and maintaining a healthy lifestyle. The best form of exercises, which we strongly encourage patients to do, is swimming, walking in the pool, and aerobics. In addition to this, physiotherapy can play a very important role. Along with this, we have been more so recently using things which are called extracorporeal shockwave therapy. In simple words, it is basically an ultrasound therapy which creates vibration across the areas which are inflamed and helps in healing them. So with regards to considering joint injections, I would advise you to get a specialist opinion from an orthopedic surgeon who can assess, who can take a detailed history, do a detailed examination, do some relevant investigations, and then really plan a patient-centered, tailor-made treatment.